As a family nurse practitioner working in pediatric endocrinology, I am seeing rising rates of children being diagnosed with the same chronic conditions that I managed in my adult patients when I worked in internal medicine and home-based primary care. I am treating and managing children with prediabetes, type 2 diabetes, hypertension, high cholesterol, PCOS, metabolic syndrome, obesity. Once seen as adult conditions and diseases, these same conditions are hitting our kids at alarming rates, in particular type 2 diabetes. Type 2 diabetes in youth is increasing in prevalence and incidence worldwide. Youth onset type 2 diabetes progresses more rapidly, with complications happening sooner than in adult onset type 2 diabetes, meaning that type 2 diabetes is a more aggressive disease in children. This is serious. As parents and adults in charge of children's care, we have to do more to preserve their health. Now, there is so much that needs to be done from a healthcare policy, health equity, and societal standpoint. And trust me when I say that I understand the impact that social determinants of health have and the barriers they place on a person's health. But I strongly encourage us parents to get the ball rolling at home to the very best of our ability. Unfortunately, we can't rely on our kids learning these healthy habits at schools. Although some schools are catching on, we can't rely on our kids getting consistent healthy nutrition at our schools. Most of you are aware of the foods that are being offered in schools. And if you're not, I encourage you to look at your school menu or ask your kids. Let alone can we rely on what they're being served outside of home or school. What's become commonplace is decreased physical activity and access to nutrient deficient convenience foods. And this is having a cumulative effect on our kids' health. We can't fall back on thinking that they're just kids, that they have high metabolisms, that they'll bounce back, or it's normal. No, it's not normal. While increasingly more common, these conditions are not normal, especially in kids. And what we know is that these conditions can be prevented, improved, or reversed through lifestyle changes. As parents, we are in a unique position to be able to instill these healthy habits and behaviors into our kids, so they don't have to learn them as adults after they've been given a diagnosis, or worse, become diagnosed in their youth with a preventable chronic condition. Yes, we absolutely have to put in work as a society. But parents, let's start with ourselves and make health a family affair.